Behavioral addiction is a serious problem that affects millions of people around the world. Addiction to behaviors such as gambling, shopping, gaming, and sex can lead to negative consequences in a person's life. In this video, we will explore the science of behavioral addiction and discuss the underlying psychology and neurobiology of addiction to behaviors. Psychology of behavioral addiction. Behavioral addiction is a complex phenomenon that is influenced by many psychological factors. One of the key factors that contribute to behavioral addiction is the reinforcement that comes with the behavior. When a person engages in a behavior that produces a pleasurable sensation, such as gambling or shopping, the brain releases dopamine, a neurotransmitter associated with pleasure and reward. This reinforces the behavior and makes it more likely that the person will engage in the behavior again in the future. Another psychological factor that contributes to behavioral addiction is the sense of control that the behavior provides. People with behavioral addictions often feel that the behavior is something that they can control in their lives, which can be appealing to individuals who feel powerless in other areas of their lives. Neurobiology of behavioral addiction. The neurobiology of behavioral addiction is complex and not yet fully understood. However, recent research has shed light on some of the neural mechanisms that contribute to behavioral addiction. One of the key players in the neurobiology of addiction is the mesolimbic dopamine system. This system is responsible for the release of dopamine in response to pleasurable stimuli, such as engaging in addictive behaviors. Another key factor in the neurobiology of addiction is the role of the prefrontal cortex, the part of the brain responsible for decision-making and impulse control. Research has shown that people with addiction have differences in the prefrontal cortex that may contribute to their difficulty in controlling their behavior. Treatment of behavioral addiction. Treating behavioral addiction is challenging, but there are several strategies that can be effective in helping individuals overcome their addiction. One common approach is cognitive behavioral therapy, which helps individuals identify and change the thoughts and behaviors that contribute to their addiction. Another approach is medication-assisted treatment, which uses medication to reduce cravings and withdrawal symptoms. Support groups can also be helpful in treating behavioral addiction. Groups such as Gamblers Anonymous and Sex Addicts Anonymous provide a supportive environment where individuals can share their experiences and strategies for recovery. Prevention of behavioral addiction. Prevention is key when it comes to behavioral addiction. While not all behavioral addictions can be prevented, there are several steps that individuals can take to reduce their risk of developing an addiction. These include setting limits. Setting limits on the amount of time and money spent on addictive behaviors can be helpful in reducing the risk of addiction. Finding healthy alternatives. Engaging in healthy activities, such as exercise or hobbies, can help individuals find alternative ways to cope with stress and emotions. Seeking help. If you or someone you know is struggling with addiction, seeking help early can prevent the addiction from escalating and causing more severe problems. Conclusion. Behavioral addiction is a serious problem that affects many people around the world. Understanding the underlying psychology and neurobiology of addiction can help individuals and professionals develop more effective strategies for prevention and treatment. If you or someone you know is struggling with addiction, seeking help is the first step towards a healthier, happier future. Remember that addiction is a treatable condition, and recovery is possible with the right support and strategies.